Again, my name is Dr. Akiba Green. Tonight we're going to be talking about new solutions for diabetes. What can we do to help diabetes and other blood sugar problems? Oftentimes, when you're diagnosed with diabetes, the first question becomes, why does this have to happen to me? And you said you may be at the stage a little bit where you're kind of worried about what's going to happen for you down the road. To give you a little background, I am a chiropractic physician. My training started at the University of Florida with a Bachelor of Science in Health Education. I was dealing on the corporate wellness, health promotion side of things, really trying to prevent injuries from occurring and illnesses from occurring. And then I went on to get my Doctor of Chiropractic degree from Sherman College of Chiropractic in Spartanburg. I have gone through several hundred hours of postgraduate training dealing specifically with two major fields of study, functional medicine and functional neurology. What that means is when it comes to research, when it comes to identifying and figuring out what's going on with metabolic problems or neurological problems, there's a good chance that I've got more experience or know more about what causes it than probably any other doctor in the area. Really, it's a different approach. And when we talk about functional medicine or functional neurology, what we're talking about is looking at how the body is supposed to operate. You're okay. You're all right, Lori. I'll see you next week. Looking at how the body is supposed to operate versus looking at how the body, is just as far as a lab point of view. I don't just want to put a label on somebody. I want to look at the whole person. Do you have family that live elsewhere?
Outside of this area?
Yeah.
Oh, yeah.
Okay, good. I consult with a group of over 650 doctors around the country. And this is important because literally we have thousands of years of experience among us. If you have a family member who has a thyroid problem, a diabetes problem, one of these different issues, I can probably help find them someone to go to in their home area. Mm-hmm. So definitely we've got access to that. Additionally, if you've heard of the concept of grand rounds, where you've got a really chronic problem or pathology, and you're at the hospital, you're at Duke, you're at Johns Hopkins, and you've got 10 doctors that are working on your case, this group of doctors that I consult with is my grand rounds. They give me access on any issue that I have. If there's something that I can't treat or something that I'm not sure about, I've got literally at my fingertips 700 doctors that I can go to who can give me that information. Okay. It's a great resource. Mm-hmm. We use the latest research, we use the latest methods, the latest tools to help patients, to get you guys back to where you want to be, to actually make changes in your life.
Yeah. I heard something on the news this morning about bariatric surgery.
Sure.
You think it's one way of curing diabetes?
It doesn't cure it. It doesn't. No, what it is it basically causes a significant weight loss because it restricts your ability to eat food.
Can you eat fruit?
Food. Okay. But it doesn't cure diabetes. It doesn't change the underlying metabolic causes. It doesn't change your blood sugar, your blood chemistry, your thyroid, your adrenals. It doesn't change anything. Okay. It just helps you lose weight.
Well, the reason why I asked because they were making such a do-over this morning on Good Morning America about this bariatric surgery and how this woman went from uncontrollable diabetes to controllable diabetes.
And again, weight loss, especially when we're talking about mortally obese patients, is an important key thing. Now, definitely not.
After I lost weight, my doctor took me off of one of the medications.
Good.
And he said if I continue to lose weight, he's going to take me off. Cut down what's left.
Sure. Yeah. We're going to talk tonight about what it means to take that medication, where your diabetes is really coming from, and what tools that are available to really help fix your body naturally. There are a lot of different options. Now, when I treat with patients who come to my office, I have some ground rules. I'm going to kind of go through these, obviously for both of you, but remember I'm also getting this all on tape because I want to have this out there for everyone else. So I apologize if a couple times I pause or something. Bear with me. It's a small enough group. I think that you'll be able to humor me a little with that, and I appreciate it. If you want to get well, you have to be committed to getting well at a level of 10. If you're a 9, I'll see you when you're a 10. You have to be willing to do what it takes with lifestyle change, with diet changes, in order to get yourself better. That is so, so important. A lot of the changes that we do with our patients, and we make really life-changing care. A lot of these patients that we help, we have to drastically change their lifestyle. We have to oftentimes drastically change their diet. And that can be tough. But, if you want to get well, you have to be committed to it. You really do. You have to take responsibility for your own health. This is another big, big issue. You have to understand that for most patients that we consult with, and once again, it may be the two of you as well, where you are right now with your treatment and what is covered by insurance gets you to a diagnosis and a pill. It does not heal you. It does not cure you. You have to be prepared to spend a fair amount of your own money if you want to truly get well. And this is really, once again, I treat a whole lot with thyroid patients and patients who have hypothyroidism or even hyperthyroidism or Graves' disease. They, are told, you have a thyroid problem, here's your pill, end of story.
Yeah.
And if you know any of it, the pills go up, they go down. I mean, we'll talk about thyroid a little bit today, how it relates to diabetes. That is not a solution. It really isn't. But that's all our medical system in this country offers us. If people want to get better, we oftentimes have to work outside of that. So, the reality is people have to spend out of pocket if they really want to get health. And it's unfortunate, but it's true. If we proceed with a consult or an examination, I want your spouse or significant other at the report of findings. Going over what we can do to actually change your life is a pretty big issue. We want to be able to have anybody who is in that decision process, we want that there at that appointment. In our country, I'm going to go over some statistics with you guys. 1 in 2 people will die from heart disease. 1 in 2 will develop some form of cancer. 1 in 3 will develop diabetes. 1 in 3 women are clinically depressed. 1 in 6 couples are infertile. 1 in 6 kids have a neurological condition. 1 in 8 have a diagnosed autoimmune disease. And 1 in 8 women have a thyroid problem. These are all considered chronic diseases. In the United States of America, we have never been sicker. The World Health Organization studied over 100 different healthcare systems in all the major industrialized countries in the world. The USA ranked number 1 in crisis care. This is very good. We have the best emergency medical system in the world. But the bad news is, in 1997, the USA ranked 34th in healthcare. In 2000, we ranked 37th. In 2007, we ranked 48th. In 2009, we ranked 50th. What happened? We got worse.
Yeah.
The U.S. ranked 41 in life expectancy. We spend more on healthcare than any other country in the world, and we have the worst health of any industrialized nation. Why aren't we number 1? There's something wrong. This is a big, big issue here. I mean, there's something drastic. Yeah, I know. Yeah, there's something wrong. There's something definitely wrong with our country, and this really goes into where our current healthcare system is operating. The U.S. spent $2.3 trillion in 2008 on healthcare. It's 3 times the $714 billion that we spent in 1990. 8 times the $253 billion that we spent in 1980. So every 10 years, every 20 years, we're spending more and more and more. And now diabetes plays a major role in what our healthcare system spends. So in 1995, something changed. We're going to go back a second. Do you guys remember the little purple pill?
For acid reflux?
Yeah. It was the first drug that was advertised on TV.
Mm-hmm.
In 1995, drug companies could advertise to the public. They changed the law. If we look at those statistics, and go back one more time here, okay? Look what happened starting in 97.
It started to go up.
Now, one of the causes is the fact that a lot of these things that we are now spending, that we are now, looking at and doing money, who's directing where our healthcare is coming from? It's not the doctors.
The drug company.
Yeah. The cost of diabetes itself, the National Institute of Health, which is that big government organization that deals with all sorts of health-related problems, they spend over $1 billion on diabetes research. In 2007, the total cost attributable to Americans for diabetes, how much does diabetes impact our society? $174 billion. That was an increase of 32% since 2002. So what the heck is diabetes? It's a chronic metabolic disorder in which the body cannot metabolize carbohydrates, fats, or proteins because of a lack of or ineffective use of a hormone called insulin. There are 3 types of diabetes. They're all different diseases, but they share certain symptoms and certain complications of what we call hyperglycemia, high blood sugar. It's a bad thing to live with. You ladies know that right now. It's a really bad way to die. And there's a lot that you can do to prevent or help it. And that's why you're here. So again, diabetes, in the United States, a study that was done, a prevalence of diagnosed and undiagnosed cases of diabetes 4 years ago, 2007. Almost 24 million people, almost 8% of the population, have diabetes. Of that, 17.9 million were diagnosed with it. 5.7 million were undiagnosed. This is scary because that 5.7 million that are undiagnosed, that's a significant percentage of where our dollars go to. We talk about where costs associated with diabetes goes from. That 5.7 million, that's a big, big issue because, hey, people go in, they have all these other health problems, and they're not diagnosed with diabetes, but they're getting kidney problems, they're getting thyroid problems, they're getting GI issues, they're fainting, they're going into the ER, they're doing all these things. They're having all this money spent on them, and they don't even know what's wrong with them. Now, this is not good. When we talk about diabetes, major symptoms of diabetes, really, we can talk about centrally, from our brain down to our respiration, to our stomach, to our urinary system, to our systemic issues. I mean, there's a lot of symptoms that are associated with it. On this diagram, I've got symptoms in blue and symptoms in black. The blue ones are more common in type 1 diabetes. What we're talking about are, increased thirst, increased hunger, lethargy, stupor, blurred vision. Your breath smells of acetone. It smells of alcohol. A definite change. Weight loss, systemic weight loss can be associated with type 1 diabetes. Respiratory problems, it's called Kussmaul breathing. It's where hyperventilation or almost wheezing. GI problems, nausea, vomiting, abdominal pain. Even difficulty urinating or increased urination. These are all symptoms that we see with diabetes. So there are 3 types of diabetes. They made it really easy for us.
I didn't know there was a type 3.
Yeah. Type 1, type 2, and type 3.
What's the type 3?
We'll get to it. Type 1 is, basically, it's been estimated that type 1 diabetes is, 3.7 to 20 people per 100,000. So 700,000 Americans have type 1 diabetes. It's about 10% of all Americans diagnosed with diabetes. The other 90% have type 2. Diabetes used to be called insulin-dependent diabetes mellitus, or juvenile onset diabetes. When I went through med school, it was called juvenile onset diabetes. We're not talking that long ago, 11 years ago, okay? Yeah, correct. Yeah. So what causes type 1 diabetes? The number one cause of type 1 diabetes are autoimmune reactions. The beta cells, they're in the pancreas. They produce insulin. They get destroyed. Significant symptoms will only occur once 80 to 90% of those cells are destroyed. So you need to have significant pancreatic damage before you actually know that you have this problem going on. Sometimes you'll see environmental exposure. Viruses, toxins, stressors can cause type 1 diabetes. And also, there's a genetic predisposition for some people. There's a genetic link for some people with type 1 diabetes. Usually occurs before the age of 30, but it's important because it doesn't have to. It can occur at any age. The peak incidence occurs during puberty. 10 to 12 years in girls, 12 to 14 years in boys is when it normally happens. The main signs and symptoms of hyperglycemia. We're talking increased thirst and hunger, frequent urination, weight loss, fatigue. Those are the biggest issues that we see. Current medical treatment for type 1 diabetes: insulin by injection or pumps, diet, exercise, education, and just monitoring. type 2 diabetes, which I'm assuming both of you ladies fall into.
I'm a type 2.
Yeah, and yourself, you said you just got diagnosed, so probably. Type 2 diabetes, they're saying 23.6 million Americans have type 2 diabetes. Of that, a third of them are undiagnosed. Type 2 diabetes is the #1 cause of acquired blindness in the U.S. So diabetes makes you go blind. It causes your kidneys to fail. It's the #7 cause of death. And something that I am really effective at treating, 60 to 70% of diabetics have some form of peripheral neuropathy. That's burning, numbness, or tingling in the feet. Usually it can spread to the hands. But peripheral neuropathy is something that a significant portion of diabetics have. And last but not least, of those 60 to 70%, most diabetics also have sexual dysfunction. So that's really not good. I mean, you go blind, your kidneys die, you can die, and you're just not going to have fun. I mean, it's not good. We don't want type 2 diabetes. We want to get you ladies fixed. We really do. So what we're looking at, it's called type 2 or non-insulin dependent diabetes mellitus, or adult onset diabetes. There are a couple primary causes of type 2 diabetes. Insulin resistance, okay? That's when insulin is unable to be utilized by the cells. And what happens is insulin wants to go in somewhere, and the cell receptors aren't able to use it. So glucose doesn't get absorbed into your cells as energy. You can also have a decreased insulin secretion. So really, the pancreas doesn't make enough insulin in response to glucose. Or you can have too much insulin being produced, and that excess production is actually coming from the liver. So you can have an inability to use it, too much, or too little, and it can all cause type 2 diabetes.
How does it affect the liver?
We'll get into it. Well, I'll answer your questions, I promise you.
Okay.
Type 2 diabetes usually occurs in adults, especially over 38 years of age, but it's now occurring in children. So an increased prevalence in some ethnic groups. African Americans, we do see an increased prevalence of it. Pacific Islanders, you also see. Asian Americans as well. Family history of diabetes, you're going to see if your siblings have it, you have a 3 to 4 times higher chance that you're going to have it. So that's a big link right there. Frequently, type 2 diabetes is overweight. You may or may not have symptoms of hyperglycemia. So the key thing here is you may have type 2 diabetes, and you may not have symptoms of high blood sugar. Okay? You may have extreme tiredness, blurred vision, delayed healing, numbness and tingling of the hands and feet, recurring yeast infections. All these things can occur with type 2 diabetes. Children between the ages of 10 to 19 that have one or more of these following areas are also at an increased risk. So kids that are overweight, prepubescent, lazy, or play a lot of video games, sedentary lifestyle, they have a family history of diabetes, they have high blood pressure, they have a lipoprotein imbalance. Dyslipidemia is actually where it's a genetic disorder that can contribute to diabetes. They have polycystic ovarian syndrome, or PCOS. Or again, if they're members of certain ethnic populations, that can significantly increase their risk of type 2 diabetes. From a current medical management, what you ladies are used to, current medical management of diabetes is education, monitoring, diet and weight management, exercise, increasing physical activity, getting you to move around more, giving you drugs, whether it's insulin, whether it's insulin sensitizers, whether it's blood sugar agents. Metformin is an example, obviously insulin is an example in Lancet. And they work on treating comorbid conditions, hypertension, you beta blocker for that, your high cholesterol, they give you a statin, and then all these other things that show up as side effects of those treatments. So that's pretty much your current medical management. That's where you are right now. Type 3, I'm just going to cover briefly, gestational diabetes mellitus. Okay. Insulin resistance due to pregnancy, and there's a genetic predisposition to that. It's commonly characterized by having a carbohydrate intolerance during pregnancy. Basically, you're diagnosed with a glucose intolerance test, and your body doesn't like the carbs properly. Treatment is diet, and provide you enough calories without causing your blood sugar to kind of go high or low. Exercise, they want a program that it's low impact, and it doesn't impact the fetus in any way. And also, they may give you insulin. So it's pretty common with type 3 diabetes, with gestational diabetes, to give insulin if you can't maintain proper blood sugar yourself. There are oftentimes other blood sugar issues, headaches, your hunger, you're sweaty, you're shaky, you get lightheaded, you get confused, you're dizzy, you're grumpy. These are things that sometimes show up, and people who think they're fine, they oftentimes indicate a blood sugar problem. Additionally, insulin resistance. So we're going to talk about this a good bit. You eat food, your body makes insulin. The cells don't want the insulin, they resist it. So sugar stores as fat, and then you feel tired and hungry as a result. And then you kind of go in this vicious cycle. Insulin resistance is what used to be called prediabetes, or is oftentimes called prediabetes. So when blood sugar goes from 100 to 126, that's insulin resistance. You can have insulin resistance with somebody whose blood sugar is 95, which looks great, but you could have insulin resistance because other issues are at play besides just fasting blood sugar. Okay? Another thing is low blood sugar, hypoglycemia. Symptoms of low blood sugar include shaking, hunger, sweating, headaches, rapid heartbeats, changes in mood, changes in vision. And after you eat, you feel great. You have energy after meals. Again, insulin resistance, just like hypoglycemia, a lot of the same symptoms, shaking, hunger, sweating, headache, rapid heartbeat, change in mood, changes in vision. But then after you eat, you don't feel good. You feel tired. It's like a crash and burn. 3 o'clock rolls around, a couple hours after lunch, and you're just wiped out. That's insulin resistance. Certain medications, again, beta blockers, diuretics, they reduce the body's ability to respond to insulin. It causes your insulin levels to actually rise, and that increases your risk for heart attacks, diabetes, and weight gain. So this isn't good. So medications sometimes can be the cause of somebody's diabetes.
Huh?
Yeah. Certain medications that you take, especially medications that are taken for heart problems, can actually cause your diabetes. They can also increase your risk of heart attacks. Oh yeah. Beta blockers, diuretics are two things that come in mind specifically. Last September, there was a bunch of news about Avandia. You all probably remember that. Study found an increased rate of heart attacks and death. What we're just talking about. It's exactly what we're talking about here. Okay, they take a drug. It causes an increased risk of significant side effects, death, okay? Congestive heart failure or stroke occurs with it. So the FDA says, hey, safety alert. Europe banned Avandia. The FDA has acted to severely restrict Avandia use in the USA. I don't think they banned it yet. They really need to. I mean, it's yeah, it's we know where the FDA's agenda sometimes is. It's not always looking out for you and me. Yeah. So the problem here, okay, and this is important, is if the current system of treating and preventing diabetes works, why are more and more people developing this disease? Type 2 diabetes is no longer called adult onset because kids now have it in epidemic proportions. Drug companies are getting rich from diabetes, $500 billion annually by 2020, they're saying. We need a new approach. We need a new paradigm to treating diabetes. So what can you do to help control your blood sugar? That's our question. Well, it's beyond that. It's not just about eating, what you're told to eat. And we're going to talk a lot about that here. So, first of all, how do you look at health? Do you look at health saying, hey, if I eat an apple a day keeps the doctor away? What we eat makes us healthy. Yeah. Or do you look at health? Food is food, and I can eat whatever I want.
No.
Yeah, a lot of people are. Again, we treat peripheral neuropathy in this office. We treat a lot of it. And a lot of these neuropathy sufferers come in. They want to eat what they want to eat. They want to do what they want to do. And they just want to come in. They want to get better. And we got to tell them, look, it's not like that. I mean, it's what you're doing. Lifestyle choices lead to the vast majority of problems that everyone deals with, including diabetes. So when you see a wilting plant, what is the first thing you think of?
Give it some water.
Yeah, maybe it needs more air. It's not getting enough sunshine. nutrients, just toxins, something, right?
Yeah.
Okay, if you see a wilting human, what do we think of? What condition do they have? What's wrong with them? They have a disease. There's something that they're missing. What drugs do they need? That's what we're thinking. We're conditioned to think with a wilting human, there's something that is medically wrong with them and that they need a drug to fix it. We're not conditioned to think nutrients, sunshine, water. You know, we don't think about that when we think of humans. Okay, so here's the key thing here, all right? All chronic health conditions have some common threads. We're talking about thyroid conditions, insulin resistance, fibromyalgia, vertigo, sciatica, chronic fatigue syndrome, peripheral neuropathy, rheumatoid arthritis, chronic neck back pain, stenosis, irritable bowel syndrome, insomnia, Crohn's disease, celiac, infertility, migraines, ADD, all these different problems, they have some common threads. First and foremost, they have oxygen deficits. They're not getting enough oxygen to the tissues. Second, there are neurological misfirings. So you're not getting enough fuel and the brain or the nerves start misfiring as a result. And third, all these conditions have metabolic imbalances. Metabolic imbalances can be blood sugar imbalances, what we call dysglycemia, cortisol imbalances, hormone imbalances, anemia, autoimmune attacks, immune imbalances, food sensitivities, brain imbalances. All these different metabolic problems lead to these chronic disorders. So every single one, all chronic conditions are a combination of neurological and metabolic imbalances. Everybody has a unique combination. Everybody's a little different with what their condition shows up as. And as such, everybody needs a little different treatment based on what we find for them. Diabetes is often the result of an autoimmune disorder. You're attacking your own pancreas, and your body is mistakenly attacking itself. You've got to get it to quit doing that. So this is huge, okay? The autoimmune connection, when we talk about diabetes, is one of the largest issues that we look at that can make a significant effect. And both of you ladies sitting right here today, to improve your condition further, looking at your immune system can make a huge difference with you. So why would your immune system attack itself? Two primary causes. Number one is what we call dysregulation. The immune system is imbalanced because of stressors to it. The other side of the coin is what we call an active antigen. The immune system is imbalanced because of invaders, antigens, something attacking or telling the immune system to attack itself. Dysregulation, immune dysregulation, can come from chronic inflammation, bad blood sugar. So actually, again, your blood sugar can be causing your immune system to attack your pancreas. Wrap your head around that one, right? Your pancreas is breaking down, leading to your diabetes, but blood sugar is causing your immune system to attack it. So it's this vicious cycle. Bad adrenal glands. Adrenal glands are your stress gland. Most adrenal problems start with stress, but adrenal gland is really important with diabetes. So we'll talk more about that a little later again. Hormone imbalances, neurological imbalances. All those different things can lead to an immune dysregulation response. But if it's an active antigen, it's like an invader. It's kind of sneaking in, attacking your body. What we're talking about are infections, bacterial infections, virus infections, mold, parasites. We have to find them and kill them. Lake Norman, sushi, traveling to the Caribbean. What are you picking up? We have a lot of patients who have bugs that they're picking up, and a lot of their stuff comes, there's a parasite that's causing their immune system to attack itself.
How do you know you have a parasite?
I mean, exactly that, a parasite.
How do you know you have it?
We test for it. Proper testing. That's something I want to say about 10 times. All right, that's key. Environmental toxins. All right. Yeah. Toxicity. Again, we talk about it. That water bottle. How healthy is it? Tap water, right? Undigested food. leaky gut syndrome, dysbiosis. We eat food, the body doesn't like it, and it creates problems as a result of it. It's a big area right there. Gluten sensitivity, specifically. With autoimmune thyroid problems, with neuropathy, the list goes on. I can tell you 100% research shows there's a high prevalence of autoimmune problems associated with gluten sensitivity. If you have an immune problem, you have to change the way you eat. You do not, if you don't, your body will keep attacking itself forever. Protozoans, Giardia, bugs, infections, again. Other factors that can also affect your blood sugar levels, how about high fructose corn syrup? That's really bad for you. How about vaccines? All right? It's a bad idea. We're giving perfectly good, healthy infants a bunch of junk to stimulate their immune system, but their immune system isn't even developed yet. You may want to talk about a delayed schedule for some. Maybe to talk about, hey, should we wait a little bit before we do that to them? What about genetically modified foods? Anything that has to do with genetic modification, I don't want to deal with. Food was put on our planet a certain way. We need to leave it alone. Artificial sweeteners, they're pretty much poisons, okay? NutraSweet, aspartame, right? The pink one. Worst thing you can put for you. When you put it in your body, you're basically embalming yourself. It turns into formaldehyde in your body.
Regular sugar?
Yeah, or change the way you eat. We'll talk about that a little bit, but yeah, I don't care what's better or worse. You got to give up artificial sweeteners. They're horrible for you. In fact, the American College of Sports Medicine said that if you do diet products, you're going to gain weight. They had a study that showed that, okay? You're not going to lose weight, you're going to gain weight.
I gave up diet sodas years ago.
Yeah, it's not just diet soda.
Sodas, period.
It's diet products in general. Anything with artificial sweeteners in it. Antibiotics in food. It's another bad idea. Superbugs. We don't want them. Skipping meals. Not eating every 2 or 3 hours, okay? You go long distance between eating. Blood sugar crashes and then spikes. And that creates a really unhealthy pattern that leads to the insulin resistance, that leads to the diabetes. Chemicals. Studies are connecting insecticides with autoimmune diseases. So what you have in your house can actually be hurting your body. And obviously a sedentary lifestyle. I don't really need to talk about that too much. We know exercise is so important for you. Not exercising will cause your blood sugar to be affected. So again, we talked about immune dysregulation and the active antigens. To identify what's wrong with an immune system, proper testing is key. We have to do the tests to find out what's wrong.
Is that the blood test?
There are many ways to this. We'll talk about them. Yeah, that's okay. So, okay. That's all right. That's all right. You go to the doctor, and they do a blood test on you. And your doctor says all your labs are normal. You've heard this before, right?
Every 3 months?
Wrong. Blood tests. I use LabCorp and I use Quest to do my testing. All right? Both big labs. I get results back, and they show a reference range. That's what your doctor's looking at. Those lab ranges are inaccurate. It's a bell curve. They're based on statistics. Who goes and gets blood work done every 3 months? Is it going to be a 21-year-old athlete? The 60-year-old person who has a condition. Okay, it's somebody who's sick. It's pathological. It's sick people. Somebody who has thyroid problems, who has cancer, who has anemia, who's got a problem with them. So if you look at the ranges that labs are getting, it's statistics. It's all those numbers put into one range. So they're based on unhealthy people. So if you're high or low on a lab test, then yeah, there's something wrong with you. But if you're within that normal range, that doesn't mean anything other than you're as healthy as everybody else who's sick. We use functional lab values that are more sensitive. They reveal problems before they're seen on traditional labs. Your lab tests are normal, but you still feel sick because they're looking for the red. Are you high or low? If you're within that gray area, they're not going to see it. But that's not right. They're not where we want it to be. There's something wrong with you. A perfect example of that is going to be blood sugar. Okay? 85 to 99 actually is where you want to be. That's normal. All right? That's 100% of the time. Normal fasting blood sugar should be 85 to 99. Okay, so if you fast, wake up and go get blood tests. That's your goal. If you come back and it comes up at 102, your doctor's going to say it looks great. It's not where you want to be. If it comes back and it says 73, your doctor's going to say blood sugar is fine. I reviewed a bunch of labs today. Half those labs were, it's a little high, everything looks great. Retest in 3 months. A little low, everything looks great. Retest in 3 months. So problems are showing up. They're acknowledging them. I'm looking at the doctor's notes, but they're not doing anything about it because they're fine with that. I have a problem with that. If there's something that's showing up wrong, we got to do something about that. TSH, thyroid, is a big, big one. TSH. The functional range for TSH is 1.8 to 3.0. If you come back at 3.8 or 4.2, your doctor's going to say thyroid looks great. That's hypothyroid. That's not right. There's a problem there. Medicine doesn't recognize these subclinical presentations. They don't care. You're not sick enough to have a disease name put on you. So there's nothing they can do for you. Does that make sense? I mean, it's disturbing when we look at the lab tests and you say, hey, what about this? What about that? You know, cholesterol is another one. We've heard of good, bad cholesterol, right?
Yes.
If your cholesterol is low, okay, 148. How about 133? Total cholesterol?
It depends on which one.
No, total cholesterol. Low. Your doctor's going to say it looks great.
Okay.
No, that's really bad. Your body's not making enough lipids. Could be thyroid, could be blood sugar, but something's significantly wrong. If your HDL comes up 85 or 90, the good cholesterol, I've never seen cholesterol so healthy before. Wrong. Elevated HDLs are just as bad. That's not right. There's something that's out of whack. Something that's not working right. It's a warning sign. You know, something's not right with your body. But it gets missed because it's not bad enough to show up with a disease name on it. So, you know, really the key thing here is I want to be able to help patients before they're so sick that it's too late to do anything about it. And that really is what makes me different from every other doctor that you ladies have seen or that anybody's seen. And we treat all of my patients neurologically and metabolically. We do proper testing. We interpret the results using functional values. I'm here to tell you tonight that in order to determine the exact cause of your condition, I leave no stone unturned. And the testing that we're talking about, no stone unturned. So diabetes is a sign of metabolic dysfunction. You asked about testing. Proper testing is crucial. It starts with blood tests. We want to do a complete metabolic panel. We want to look at your thyroid, your vitamin D, so you know you're on metformin. A study came out a couple years ago that showed that metformin decreased insulin resistance by 40%.
Repeat that?
Metformin improves insulin resistance or diabetes by 40%. Vitamin D improves insulin resistance by 60% by itself.
Just plain old vitamin D.
Yeah, dosing comes to mind. You got to use it properly, but yeah. So you can take metformin, or you can supplement with vitamin D, which is a heck of a lot safer and a lot cheaper.
Yeah, it is.
And it's going to do a better job. So again, do we want medications, or do we want to get well? Do we want to fix our problems, or do we want to manage our problems?
I want to get well.
Yes, absolutely.
To be 120.
I like it. I like it. So we look at the immune system. We talk about the immune system. We need to check and see if you have these immune imbalances. There are two halves of the immune system. Th1 and Th2 are what they're called. And if you have an imbalance, if you have an autoimmune condition, you have a shift into dominance where one of them is pushing, it's firing the wrong way. When that happens, the Th1 versus Th2 system, it breaks down, you know, and it stays that way, and it attacks your body. So we want to test for that. We test for that through a blood test. You want to do a CBC. You want to look at your white blood cells. You want to look at your red blood cells. You want to look at iron. You may see anemia in red blood cells, but you want to look at iron and ferritin and see, is it because of an iron problem or is it because of inflammation? You want to look at your adrenals. The adrenals are best tested through a salivary hormone test, a saliva test. It looks at 24 hours of cortisol levels, 4 times of the day. Do either of you have trouble sleeping? You know people who do. If somebody has problems sleeping, cortisol is the number one thing you should be looking at because it sets your sleep cycle. It should be highest in the morning, lowest in the evening. If it's abnormal, then there's part of your answer. You want to do food sensitivity testing. You want to look for gluten, dairy, egg, soy, yeast. How about corn or coffee? How about you're gluten-free and you've gone through that testing and you know you have a gluten problem, but you still feel sick? And in your case, the problem is you're eating all these grains to replace gluten, like quinoa or brown rice or millet or buckwheat, but your body's reacting to those as well. We can test for that. We want to look for infections, gut infections, parasites, fungus or yeast overgrowths. We do that through stool tests. So there's testing that is designed to help find what's wrong with your metabolic function. And again, proper testing is crucial. That's the key thing here. So the analogy I'm going to give you is your current medical management is like skeet shooting in the dark. You can skeet shoot. You don't really know what you're going to hit, though, do you? Exactly. You don't know. The difference is skeet shooting in the dark or having a sniper to take out your enemies. I want a sniper to fix my body. I want to know what I'm going after. I want to make sure that my body is working the exact way it should and that I'm not going in blind. Without proper testing, you're skeet shooting in the dark. Functionally based healthcare is what we do in this office. It's based on lab findings using functional values. Our protocols are designed to help support the body's own pathways. We want to get the body to heal itself. We have priorities that we look at in metabolic function: gut health, liver health, adrenals, blood sugar regulation, autoimmune regulation, thyroid, anemias. These things that we look at, we identify where your patterns of dysfunction are. I oftentimes use an analogy when I talk to thyroid patients of a bicycle wheel, with the hub being, the dysfunction, and all the mechanisms being things that are causing it. How many, all the spokes around the wheel, all those mechanisms, how many problems are we dealing with? We want to identify them and then correct them one at a time. So I'm able to help you by simply running the proper tests to find out why you have diabetes, not just giving you a diagnosis of you are diabetic. Using that information, it allows me to address all those different mechanisms, all those variables in the equation. I can treat you, the person, not the disease. When you're given a medication and basically put out the door, they're treating the disease, but they're ignoring what's causing it. So, again, I hope I've given you ladies a good bit of information tonight. Just to kind of recap, again, if you're interested in meeting with me, I would love an opportunity to sit down one-on-one and see if we could help you. The approach that we have is completely different than what you're used to. It's based on science, evidence-based, looking at the big picture, looking at you, the person, and saying, hey, let's find out what's actually not working right with you. If you do want to come in, you have to be committed to getting well. There's a good chance we're going to find dietary issues. We're going to need to make those changes. If you don't make those changes, you're never going to get well. You have to be prepared to take responsibility for your own health. You have to understand, again, that there is going to be out-of-pocket expense, that insurance doesn't cover most of these tests. Some of the blood tests I can get covered, usually, but a lot of the specialized tests that we do, they don't cover. They don't cover my time. So you definitely want to go into it, and you want to make sure that you understand that you're looking here for your health, not just because of a number.
When you say dietary change, what are you discussing here? Dietary change.
Do you have to give up eating gluten? No, you don't know that. That's the point. You don't know that.
Well, maybe I don't know it, but nothing has ever affected my eating.
Mm-hmm. Except the fact that you have diabetes.
Yeah, I do. And at the time I was told it was hereditary.
What does it mean to be hereditary?
Someone on your family tree had it before you got here.
It's a rhetorical question. What I'm getting at here is, with hereditary diseases, I buy into, I only have one lung because my family's always been that way.
Okay.
You know, something congenital, right? But when we talk about a hereditary disease, you talk about those people who everybody in my family dies at 40. So I'm not going to die at 40, right?
Mm-hmm.
Okay? So and you see stories like that, right?
Yeah.
That's hereditary. Why did they die at 40? The body doesn't just give out. It's what you do with it. You have the ability to determine what your body does. I do not believe that you getting diabetes was destined the moment you were born. It wasn't. And if you believe that, like I talked about, we talked about the rules, if you believe that, then you will not get helped. I mean,
My brain is always open to new ideas.
absolutely. And what we've talked about here is, I mean, again, the concept of where your body is breaking down, what is causing your diabetes. That's what we are looking for.
Now, is there such thing as a cure for diabetes?
In many patients, what I will tell you is we have seen people go from blood sugar of 180, A1Cs of 7 and 8, to A1Cs of 4.5, blood sugar of 86, and stay there. What does that sound like to you?
Okay.
There are no cures in medicine. There are no promises in life.
There's no guarantee.
There are not. But I can tell you that we see it every day in our practice. Like I said, we see people completely correct themselves. And the key thing with this here is if they stop doing what it is that they did to get there, they're going to go right back. So I look at it more as a remission. If you maintain the lifestyle changes, if we identify what's causing your diabetes and we support it and get the body fixed, and you follow through with that lifestyle, then for all intents and purposes, yes. If you revert back, then the condition's going to come back. Well, that's not a cure, because by curing, you're indicating that it's never going to come back. Yeah. You have to follow those lifestyle changes. You have to do what it needs in order for that to return. Remember, diabetes is a progressive degenerative disorder. It's going to get worse. We talked about all those stats at the beginning. Diet, exercise, and drugs are not enough. Unless you do something now, it's going to continue to progress. And I mean, have you ever heard? I heard a story. It's really, actually, it's a friend of mine. His dad died of diabetes, and it's really sad because the reason he died, he used a toe nail clipper, and he cut himself, and they couldn't stop the bleeding. I mean, it really, it's. Are you kidding me? I mean, you know, it's this disorder doesn't need to get that bad. There are solutions to it. We've talked about them today. So with both of you ladies here, if you think about in the future, 1 to 3 years, where do you see yourself if you continue on this path?
On the path I'm on now?
Yes, on the path you're on right now.
That's a good question.
How about 7 to 10 years? I want you to look up. Where do you see yourself?
Ooh, Jesus. Not there.
60% of diabetic deaths come 60% of deaths due to diabetes come because of issues like this.
I know.
Yeah.
And how do you, Jesus.
10 to 15 years. Or if you do something about your health, if you realize that there are other solutions out there, where do you see yourself?
I told you, I'm living till I'm 125, so figure it out.
Are you willing to make a change? If so, I can help. Absolutely.
I'm on fixed incomes and I can't afford to pay any money out of my pocket.
Sure.
But it's been an eye-opener.
So the question becomes, we go back to commitment level. Okay, because I have retired people in my practice. I have patients that are on Medicare, Social Security, and that's all they're on.
Right.
You know, lots of them. And if they can't afford $100 a month for care, if they can't afford
For how long?
doesn't matter. It depends on the case. I mean, it doesn't matter. And I'm not offering you a payment plan right now today because I don't know what you need, but if you can't afford something basic, because these patients can. I've had patients that came in who were unemployed, who wrote a check for $7,000 for 2 of them for a year of care. Okay, so I mean, and we talk about what the testing is required. Sometimes we got to spend a good bit of money on testing, and that's where a lot of it comes from. But there are solutions, and you have to keep in mind that if you think I'm on a fixed income so I can't do it, you won't do it. And again,
I say I'm on a fixed income. I didn't say I can't. There's a difference.
There is absolutely a difference.
But I'm on a fixed income, so I'm under a certain umbrella I have to.
Yeah. Oh yeah. I understand 100%. I understand that. And unfortunately, the system that we live in, where you are with your current health, you're not going to see a difference from what you're already getting. I mean, that's the key thing here. If you want,
you're saying that where I am with my diabetes now, it's not going to get any better.
It's not.
Not even with diet change, exercise,
I mean, that's not enough. It's not enough. The vast majority of patients need more than that. Not everybody, but the vast majority of patients. There's something. So the question becomes, you do everything that your doctor told you to do.
Yeah.
And are your numbers where they should be?
Some of them, I don't know, because I'm not an expert on
And
I went from, my A1C went from an 11 to a 5.
Mm-hmm.
So I don't know how that helps me.
How often, when was the last time you had it checked? Was it just checked as a 5? Has it stayed there?
My 3-month checkup is next month.
And are they doing another A1C on you, or do they do an A1C every 3 months?
Every time.
Okay. Has it stayed at 5 for more than 3 months?
Yeah.
Okay.
It was at 5 the 3 months prior to this one.
So you don't know yet. You'll
the
see.
last checkup.
Yeah.
So I don't know what the next 3 months going to bring. But I do know my fasting blood sugar in the mornings now has been down to 96.
That's great. That's great. Yeah. Now 100, 102, 103, not great. 96, great. So again, the issue is everybody is different, and without meeting you and talking one-on-one, I don't know what your issues are.
Yeah.
I mean, but I can tell you from experience that, and shoot, it's not my experience, it's statistics, that
I understand where you're coming from.
my father-in-law,
Those inquisitive patients, I ask a whole bunch of questions. I want to know when I go for my blood test, you checking my kidney? Or maybe I'm asking the wrong question. I want to know about my kidney. I want to know about my liver. I want to know about my thyroid. I want to know about my A1C. Those are my 4 questions I ask every 3 months. Now, maybe I'm asking the wrong question.
I have a feeling the issue is you're not getting the answers because you're asking the questions, but they're not doing the tests. That's the issue. They're not doing the right tests. Okay. But listen, I'm looking for sick people to help. Okay. If it's not you, you know somebody who has a problem, who has thyroid dysfunction, who has diabetes. Right. And we want to help those patients. That's my goal here.
Well, I do have diabetes, but I'm always looking for help.
Yeah.
But it's something that I'm going to have to go home and think about, because you're not moving us.
I'm not moving, but what we do, and for what it's worth, and again, I don't know if I have something that would help you or not. I don't. And we talk about whether there's something that you need. We'd have to look at your case and see, hey, oh yeah, absolutely. What I do, we do 2 visits. The first visit is an examination, case review. If you've had blood work done, my staff will request that blood work and we'll go through everything. Okay. The second visit, if I think that I can help you, I'll present to you what your options are. We'll go over what treatment plan I'm going to recommend for you. Okay. Usually that's a $245 process. If you schedule tonight, it's $125. If you schedule and pay tonight, it's $45. Yeah. We're looking.
You're just saying you want $45 tonight.
if you want to come see me and you want to save $200, then you have the opportunity to pay $45 tonight to do that.
And I'm gonna do that because I have my situation over my pressure is not staying where I want it to stay. It's too high.
Sure.
It's just too high. And you can't be. I mean, I'm worried.
Let me give you ladies a story. My father-in-law has diabetes. Okay, he's got neuropathy. He actually uses one of our infrared lights that we use for patients in the office, and his sensation has improved a lot in his feet. He lives in Sarasota, Florida, and and he can't feel his feet because of his diabetes. And I mean, he walks from his car to the beach, like if they're at the beach, and you know, in the sun, 120 degrees, he could walk barefoot, wouldn't even feel it. I mean, that's how bad it is. His diabetes is getting worse. His doctors have him on, he's on glucophage and he's on something else. He also uses Lancets, he uses insulin. Sometimes he'll go out, he'll have a nice dinner. You know what, I don't care. Let me get me in the stomach and I'll get my insulin. And he's not really paying attention to, the ups, downs, the effects of what that does with him. His health is getting worse. And yeah, it's really not. And he's, even with me being his son-in-law, he's really traditional medicine, and that's his way. And I mean, it tears me up because I know. I mean, he's got a hip issue now. They said it was bursitis. No, it was a lumbar disc, and after 3 months of injections and hobbling around, they finally did an MRI and they sent him to PT and a chiropractor, and he got better. But again, medical management. We talk about, how are they treating somebody? They go off and they say, hey, this is all we know. It's got to be A, B, or C. And if it's not that, then it's nothing else. And the reality is, that's not reality. I mean, people. I mean, we talk about, where people are. Is their diabetes stable? My risk is, maybe yours is, yours isn't. And the question becomes, what happens with it? Are there solutions that we can do that can improve your health, that can get you going the right direction? And, we can do it, and depending on what we can find, what you let me do testing-wise, and what we can go into and find out where your condition's coming from, there's a lot of good that we can do for you to normalize that. And, I mean, we can turn your life around. And we've seen some pretty neat studies.
That's good to know. That is really good to know.
I'm here to be a lifesaver.
Huh?
I'm here to be a lifesaver. I'm here to offer that help for whoever's willing. And I'd be more than happy to meet with you. Absolutely.
But like I said, tonight is not a night I can.
Oh, you're fine. That's all right. Yeah. But do you just have any other questions for me?
So I was concerned about the blood test. Like, I've been in the hospital this month, and they did twice in the hospital twice and did blood tests, and they always came back and said that everything's okay.
So one of the things that we do when we meet is we'll get all those tests, and I'll look at them, and I'll put them. I have a software that I put them through. It's a functional nutrition software. It's a functional blood chemistry software, and I'm able to look and see. I mean, if you give me, let's say we do 10 glucoses. All 10 of them are right next to each other. It shows your values, the functional range, and the absolute range, the lab range, and we can see where you are compared to not just what they're saying, but where you should be for every test that they've done. And so we'll know, if things are where they should be or if there are problems that show up that aren't bad enough for them to put a label on. But they're bad enough to affect you. Does that make sense? Yeah. Well, ladies, I enjoy talking with you. Thanks for coming out. No, you're great. Yeah. Our thyroid seminars that we do, we usually have 10 to 15 people here. Diabetes, for some reason, the first ad that we ran last week, we had to reschedule. I had another. Unfortunately, the date didn't work when we had some patient issues. But we're going to have a lot more of these as well. And of course, we've we recorded it to put it on DVD. So the opportunity will be for anybody who's looking for this information, for it to be available for them to really